This is a presentation on the core determinants of health presented by Donna Hazelwood for the Community Health Nursing 2 N493 class. I'll be talking about the core determinants of health and by creating a definition of the core determinants of health, talking about the impact to target population, and closing with a promotion of health communities and lifestyles. The definition of the core determinants of health is that it is an influence that can affect an individual's quality of life as a result of factors such as age and gender, habits such as alcohol use or smoking, employment and income, the home environment or the neighborhood that you live in, access to health care and affordable health insurance. The target audience I'll be focusing on was due to the completion of a community assessment in N493, Community Health Nursing. It was discovered that in Cottonwood, Sedona, Arizona, which is a rural community, the #1 cause of death for people ages 44 to 85 plus is heart disease, which occurs every 40 seconds on average. This statistic is from 2010 from a health assessment that was done for the state of Arizona, which stated that more men, 179.8, than women, 112.2 per 100,000 people, died as a result of cardiac disease. Heart disease is the second leading cause of death in Arizona statewide. This statistic can drastically be reduced by making some choices that will impact its occurrence. Community outreach by healthcare professionals can make an impact by providing resources and educating the public on how to make wise decisions and control health issues. By reducing the occurrence of heart disease, it will make an impact and help to reduce the cost associated with hospital admissions. Involving the community environment in which we live shapes our health. There's an increasing number of people that deal with chronic illness, some that have more than one chronic illness, which is impacted by environmental factors. It's vital for communities to come together to make healthy choices. These choices affect everyone that begin at birth and go until the elderly. Healthcare professionals are an important aspect of bringing information to their community. The more information that individuals have, the more empowered they can be in their life. It's important for there to be an awareness of modifiable risk factors in order to make a difference. Some of these are exercise, making healthy nutrition choices, not smoking, and controlling hypertension and high cholesterol. The statistic found at the azdhs.gov website stated that hypertension and cholesterol accounts for approximately 25 to 40% of the people of Arizona that are unaware of these conditions due to not seeking medical care regularly. And it is two very big factors that affect cardiac disease, and it's not being followed. So to promote healthy lifestyles, healthcare professionals must motivate the American people to promote and protect their own health. There are a number of ways to educate the community on the importance of living a healthy lifestyle, such as with emphasizing regular visits with a primary care provider, providing information on available resources, and that could be written material, it could be information that's found on the website. It can be information that is provided through the hospital, such as the cardiac rehab program, nutritional programs that exist, presenting information to the public on health topics of interest, which could be done through the local library or at the health center in the town, and recognizing health concerns such as hypertension and high cholesterol, making healthy choices with regards to exercise, nutrition, and sleep, and being moderate with alcohol consumption and no smoking. The trend in healthcare today is for the patient to be knowledgeable and empowered in their health so that they can be part of the healthcare team in making decisions about their health. The references that I used were from the Arizona Department of Health Services, which was an Arizona state health assessment, the Centers for Disease Control and Prevention, which talked about the social determinants of health, and our textbook, Population and Community Health Nursing. I also used images from the yahoo.com website that focused on the images that were used in the PowerPoint presentation. That concludes my presentation, and I hope that it was informative and provided the information that was required for our assignment.